Hi guys, so welcome to Alpha Physio Pelvic Health, and today I would like to talk about pelvic organ prolapse in the context of post-pregnancy. Pelvic organ prolapse is a vast topic. It's really big and we can really talk about it for hours and hours on, but today I would like specifically to talk about pelvic organ prolapse in the context of post-pregnancy and post-birth. So if you find this video interesting, don't forget to press like, subscribe all things pelvic health, and let's begin. So first of all, I will give you a very short, brief introduction on what is pelvic organ prolapse and certain symptoms you may expect, although not always, with pelvic organ prolapse, and why we are talking about pelvic organ prolapse today specifically in relation to post-pregnancy. So our pelvis, here is our pelvis, contains our organs that are there and providing their function. Also, I would like to mention that today I specifically will talk about females, obviously in relation to pregnancy. There can be specific pelvic organ prolapse in males, but today the topic is on female anatomy. So our organs sit nice and tight in our pelvis, and they are not sitting there just up in the air. They are supported by our pelvic floor muscles and something that you can't see here, but a lot of fascia and ligaments. So it's kind of a net of connecting tissues that is supporting all these organs in place. And when these organs are in place, they're functioning nicely. We are going to the toilet with no problems, peeing, pooping, our period is fine, and so on, and we can also potentially carry a baby. So what is a prolapse? Prolapse sounds scary, but basically it's a term that describes when the organ moves out of its place. It can be your bladder, it can be your uterus, it can be your rectum, it can be all of them in any combination together. There are certain degrees of pelvic organ prolapse, which is from 1 to 4, and it describes the severity. Today I will not dive deeply because it will take us another good half hour to explain it. But the lower it goes, the lower the organ drops, usually the more symptomatic person becomes. Now, let's talk about pelvic organ prolapse in relation to pregnancy. First of all, I would like to mention that pregnancy indeed is a risk factor for pelvic organ prolapse. However, anyone who has pelvic organs can have a prolapse. It can be a very young woman who never gave birth. It can be a woman at any age who never gave birth. It can be a woman who had 5 babies. It can be a woman who never had any issues and then only had prolapse when she hit the menopause. So it can be anyone at any time. There is no certain limit by age or by birthing modes or by birthing status. As you get pregnant, uterus, this is actually the original size, maybe slightly bigger. It grows quite big to accommodate on average 3.5 kilo baby. So imagine all those tissues that are supporting uterus, your bladder, your rectum, your pelvic floor. They're undergoing quite a bit of strain and stress. And it's not only once off, it's through the 9 months, through the movement, through the daily activities. So obviously, certain stretch will occur in these organs and around the area. According to research, 3 to 50, so you can see how huge is the difference, 3% to 50% women after giving birth will have some sort of pelvic organ prolapse. So if you take systematic reviews, which is basically a summary of all the research that is made on pelvic organ prolapse, it's very heterogeneous, meaning the data is very, very different. So it's safe to say that getting a certain degree of pelvic organ prolapse after birth is fairly high. Now, about 50% of the women will not even experience any symptoms. So they will happily give birth, whether it's a cesarean section or vaginal birth, and they will not have any symptoms, which is great. You know, you're asymptomatic, you continue on with your life, so what is the problem? Now, the problem is the future. The future pregnancies, potential ones, if a woman wants more than one kid, menopause, and age. So if you have a certain condition, let's say pelvic organ prolapse, your bladder is dropped a little bit, maybe a little bit your uterus, but you don't really feel it yet, and you don't really do anything about it, you don't further investigate it, it can be years and years and years before the symptoms really manifest themselves. And usually, as a rule of thumb, not necessary, but usually, the more severe the prolapse, the more symptoms the woman has. It can be pain. It can be pain in the low back, in the front. It can be dragging pain in between the legs. It can be constant feeling that there is a ball in the vagina or something is about to fall out, this distinct sensation that something is falling out. It can be difficulties with intercourse. It can be inability to do physical activities because it's just that heavy and dragging feeling that is around the vagina or rectum. It can be constant toilet trips because of the prolapse bladder, although when you go to the toilet there are just 3 drops coming out. It can be difficulty pooping and constipation that is not really related to digestion, but because there is a prolapse and the feces are stuck in that prolapse and they're drying out. So a lot of symptoms that can come later on in your life, whether it is later after your first pregnancy or years later, but they can manifest. So here, the prevention is the key. So how we can prevent and reduce our chances by having any issues with pelvic organ prolapse. Well, it might sound not very positive, but I would put assumption that every single woman who gave birth has pelvic organ prolapse. Therefore, we need to give her a minimum amount of tools that are not very, as you will see now, I'll explain to you, not very difficult. This is not something very hard, and she doesn't really have to have the prolapse, and we don't have to say, oh, you do have prolapse. It's just, as a professionally, I would assume any woman that walks through my door, she might have a mild prolapse. So let's give her the basic tools to help herself to avoid any complications in the future. Me, myself, I also have pelvic organ prolapse. I have present. I do control them very well through exercises, and I have absolutely zero symptoms. But I do have them, and it's my investment in my future in order to preserve the quality of life as I get older. So, what shall we do to avoid any complications that may arise from pelvic organ prolapse post-birth? Because birth and pregnancy and birth is the most the events that are most likely to cause these issues. Not only, but we're talking specifically here. First of all, after birth, make sure you go to your gyno. You don't miss your post-birth checkup. This is very important. To check, vaginal checkup, ultrasound, to check the stitches, whether you had vaginal or cesarean birth. Gyno checkup must have. There is no issues with your with any, the word came out of my head. Infections. There is no issues with infections and so on. Then I would really highly recommend you to take the initiative and book yourself an appointment with pelvic floor physiotherapist. I know that in Belgium and France, maybe Netherlands even, and probably even Poland, these are certain amounts of session of pelvic rehab is a must-have in the country. Whether you've been diagnosed with organ prolapse or not, whether you had super easy birth that you've been running 2 days later, you need to go and do these sessions, because it's investment in your future from you, from person's point of view, and it's investment in the country's future and reducing the budget on treating the problems that may arise from post-birth pelvic organ prolapse. So I would advise to go and check with the physio to assess your pelvic floor strength, to assess your organ position. Usually it's done manually, digitally, with the finger, in the different positions. It usually happens in standing, in laying, and 4-point kneeling. And pelvic floor physio, such as myself, will give you the basic safety advice. We teach you proper pelvic floor contraction and breathing and engagement that you can use through any type of exercises you decide to go on. It doesn't have to be only that. We give you some tips and tricks about the toileting, how not to strain, probably show you a couple of modifications of exercises for abdominals and so on to avoid. Check you for diastasis recti, abdominal separation, that can be also co-contributor to pelvic organ prolapse because there will be not enough of abdominal support. And I would really highly recommend you to do rehabilitation program for the pelvic floor at least 4 to 6 weeks. In ideal world, it will be up to 8 weeks, which is 2 months, 4 to 6 weeks. It can be anywhere between 15 to 30 minutes, 3 to 4 times a day. And I know that this is like, crying baby and it's difficult and, you're right into the motherhood. It doesn't have to be right after that 6 weeks. You can do it whenever you're ready. And before you're willing to go to any other exercises such as running, maybe you were doing Zumba before, maybe you were doing HIIT training or any training, specific training for pelvic floor post-birth rehabilitation. This is something that you will learn. This is something that your body will get used to it, and you can use it throughout the life, and it will be great investment into your future. So I think I kind of provided you the main points. So let's, guys, summarize. First of all, pregnancy is the main stressor of the pelvic floor and pelvic organs. Then it's birth. We need to assume that we might have pelvic organ prolapse, even if we're not symptomatic. Therefore, we check for it, and if we don't have, that's great. Therefore, we do a basic post-pregnancy rehabilitation that involves pelvic floor, core engagement, breathing. We don't strain our pelvic floor and our body early after birth. We take it easy for first 3-4 months. Make sure you don't miss any of the doctor's appointments. If you have more questions, guys, you can ask them down into the comments. Feel free to ask me questions. I would also like to mention that me as a pelvic floor physio, I do provide a rehabilitation program that has 12 lessons, 30 minutes each, that are targeted specifically for post-pregnancy rehabilitation. So remember, invest in your health now, and believe me, this investment will pay off greatly in your future. The quality of life that you will get by investing a bit of time and effort now, it's going to be just great. Thank you for being with me. Thank you for watching this, and we'll see you very soon.